Good afternoon, everyone. We're gonna just started the broadcast, so we're gonna give people another minute or so just to let the participants enter the main webinar room. All right, looks like we have numbers going up more slowly. So good afternoon, everyone. My name is Molly McGarrick. I'm the Cabinet Secretary for the Department of Health and Social Services, and I'm so pleased to welcome you to this virtual press conference this afternoon. Today, I'm so honored to be joined by Lieutenant Governor Bethany Hall-Long, Dr. Carol Rattay, our Director of the Division of Health, Alexis Teitelbaum, Acting Director of the Division of Substance Abuse and Mental Health, Dr. David Tam from BB, as well as many others so we can talk about some new ways that we will provide critical support to individuals with substance use disorder as well as their families. First, I want to say this. We know that the COVID-19 pandemic has been difficult mentally and emotionally for our entire community, but none more so than Delawareans struggling with addiction, mental health, or both. Earlier this year in May, we lost 39 people in our state to suspected overdoses. Sadly, this tied a monthly high previously set in August of 2018. We fear those deaths, and many since then, are a consequence of the uncertainty and the disconnectedness associated with this public health crisis. Through December 8th, Delaware has reported 316 suspected overdose deaths, which is well ahead of where we stood at this time last year. We ended 2019 with 431 total overdose deaths, and we fear tragically that 2020 will eclipse that number and perhaps even approach 500 lives lost. To help save lives, we will announce today a new way for Delawareans to access naloxone, which is a medication that can reverse an opioid overdose. This will be added to the current methods that people can use to access naloxone, which includes at our bridge clinics in each county, through their doctors, during training sessions, and at pharmacies. This is such a critical step forward in saving more sons and daughters, mothers and fathers, sisters and brothers, colleagues, neighbors, and friends. I also want to encourage all Delawareans who are struggling with substance use disorder, anxiety, depression, or any other behavioral health crisis to please not be afraid to ask for help. And I'd like to offer a few ways. They can call our 24/7 Delaware Hope line at 1-833-9-HOPE-DE to talk to a trained professional. They can visit our helpisherede.com website to find services and resources, including support groups. Or talk to your doctor, someone at one of our bridge clinics, or another trusted healthcare professional. And finally, we know that the holidays are such a difficult time of year for so many, especially those with substance use disorder or other behavioral health challenges. And that's why initiatives like the one we're discussing today, coming at this time, are so critical. Now it is my honor and privilege to introduce you to somebody who has been working on the front lines of so many things this year, including the pandemic and obviously the addiction epidemic. So please join me in welcoming Dr. Carol Rattay.
Thank you so much, Secretary McGarrick. And I'm going to share my screen here. And I'm going to share some slides with everyone that I'd like to go over. So to all of those on the call, I really want to thank you for taking your time to be with us for this important discussion today. Sadly, in 2018, from 2018 data, Delaware's ranked second in the nation for our overdose deaths. And certainly the COVID pandemic did not help. So although the pandemic has not caused the opioid crisis, it certainly has made it much worse. But when we look back over the past decade, we've seen drug deaths in Delaware increasing year after year. So when you look at this chart here, you can see an 88% increase when you go from 2015 to 2019, which is really just so tragic. We went from 2015, we had 229 overdose deaths. Moving on to 2019, we had 431 overdose deaths in Delaware, according to our Division of Forensic Sciences annual report. So why is this happening in Delaware? A lot of reasons, but the significant increase in deaths we know is driven by fentanyl in our drug supply. Fentanyl is lethal in small doses. It has no taste or smell. And so often people are not aware that it's in their drugs. And it's now being mixed in with a variety of different drugs. So if you look at this chart and you see from 2019, among those who passed away, 341 of those individuals had fentanyl in their tox screen. We also see a mix of other drugs too. So cocaine has been on the rise in the last few years, and 169 individuals who died last year had cocaine in their tox screen. Heroin is also common, but we're still seeing prescription drugs being a significant problem among those who are passing away. So that not only includes opioid prescriptions, but also other non-opioid prescriptions like benzodiazepines. So the pandemic has been devastating to Delaware in so many ways, and that includes for those who are struggling with substance use disorder. The number of overdose deaths in Delaware has climbed dramatically, and there's a lot of reasons for that. The increased pressures and stress of COVID, increased challenges for people getting the treatment that they are used to, and social networks or support groups that many people usually find helpful, and face-to-face gatherings have decreased significantly and often been eliminated. Additionally, people have struggled with unemployment and housing access issues, and just a variety of stressors that have added on top of a crisis that was already one of our, if not our greatest public health challenges prior to the pandemic. Already this year, 316 Delawareans have passed away from suspected fatal overdoses, according to the Division of Forensic Sciences. And that number is expected to climb because not only do we often see a spike in overdoses in December, but we also typically our numbers are about 4 to 6 weeks behind due to the analysis done from the Division of Forensic Sciences. And so like every year, unfortunately, we expect our numbers to go up still quite a bit. Now, Delaware is not alone. Other states across the nation are experiencing similar increases in fatal overdoses as more and more people are struggling with the many stressors related to this pandemic. But one of the things we know we can do is help get naloxone into the hands of more people. Our own data suggest that about 80% of our overdose deaths happen in residences, so in people's homes, and about 90% of the time, they don't have naloxone on hand. So despite the Division of Public Health's broad and urgent response to the COVID-19 pandemic, our dedicated teams have never stopped working on the drug overdose crisis and helping those who are struggling with addiction or its ramifications. Today, we announced that Delawareans can now order the life-saving naloxone by mail. Our Office of Health Crisis Response has forged a partnership with the New York-based Next Distro, a harm reduction nonprofit, to help those the most who need naloxone. help them order it privately and conveniently. Naloxone has about a 40-year history of reversing opioid overdoses and saving lives, giving people enough time to call 911 and for first responders to arrive. Our goal is to make sure that all those who may need it at any point in the future have it on hand and they are ready and know how to use it. We're really very pleased to partner with Next Distro, which has a proven track record of offering similar harm reduction programs in 35 states, including our neighbors of New York, New Jersey, and Pennsylvania. And they have already, since 2018, delivered more than 16,000 free naloxone kits to households across the United States. So for those who want to order naloxone by mail, they can visit the Overdose Prevention section on helpusherede.com. Secretary McGarrick already mentioned helpusherede.com. And when they go to Overdose Prevention, then you can find the Next Distro icon, which will take you to the platform where people will watch a video, they'll take a short quiz, they'll fill out a form, and before they know it, they will have received their naloxone by mail. And very importantly, all information is kept confidential. We're also simultaneously launching a campaign, a Narcan awareness campaign. We are converting to the easier to use brand name Narcan version of naloxone and launching the statewide Power to Save a Life campaign. And this will appear on social media, on bus shelters, radio, and even on gaming apps. We want everyone to be aware of the importance of naloxone, where to get it, how to use it, and to be ready to use it to possibly save a life if they ever need to. We also want to make sure that Delawareans are aware of the Opie Rescue DE app. You can just search this at an app store, download it onto your smartphone. And what this will do is first of all, it has a directory, so it can tell you where's the closest pharmacy to get naloxone. It also provides, very importantly, information about how to detect an overdose, and it will walk people through the step-by-step instructions of how to use the 3 different versions of naloxone available if they ever need to. We know that when it comes time to use naloxone, it's a scary and frightening time for people, and to be able to just click on this app and be walked through the steps can really make a difference for people. So in addition to everything else going on this year, we've held 80 overdose trainings and naloxone events, including since April, 62 car side events, COVID-friendly car side events. And we've distributed over 6,000 naloxone kits already by the end of the third quarter. But as it gets colder and our COVID-19 cases are increasing, these types of events are more challenging to run. And this also is a reason why the mail order naloxone is so important at this point in time. Again, it's convenient and it's private, and it allows individuals to avoid perceived stigma that they sometimes feel when requesting naloxone. We know that Narcan or naloxone is not the only answer by far to this opioid crisis. And that's why we're also launching a statewide awareness campaign on the virtual tools that are available to Delaware residents on, again, helpusherede.com. Our colleagues at DSAM have done a really great job of getting some tools out there. Secretary McGarrick already mentioned the Hope Line 24/7. A resource and support for individuals, but there's also an Atlas searchable database that offers real-time information about treatment availability. but also locations for where to find naloxone is there, as well as locations for prescription drug take back boxes, and a variety of other resources. So this new campaign is really to make people aware of what resources are out there and to drive them to the helpusherede.com website to find these resources. Now, this particular campaign began this month, and it will run on billboards, radio, social media, bus shelters, and even at 39 grocery stores and pharmacies statewide.
Help is having compassion, because addiction can affect anyone. Help is knowing how to prevent an overdose. And help is always being ready to stop one. Help is here. With prevention, treatment, and recovery resources for all Delawareans.
So I didn't realize when I pushed that button, you would actually see the campaign, but that's it. And so Delawareans are going to be getting that information in a variety of different ways. So we hope that that Delawareans come to the helpusherede.com website and find the resources that will help those who are struggling with substance use disorders, as well as their loved ones, to be able to use the tools that are available to them to help them make it through this incredibly challenging time. And so now I would like to introduce the next speaker, and it really is my honor and privilege to get to introduce our Lieutenant Governor, who truly is a tremendous leader in helping us as Delawareans get through this opioid crisis. Dr. Bethany Hall-Long is an expert in health policy and public health nursing and many, many other topics. And she also chairs the Behavioral Health Consortium, for which we are just so grateful to her for her leadership. So without further ado, I am very happy to introduce Lieutenant Governor Bethany Hall-Long.
Well, thank you, Dr. Rattay, and to our incredible secretary and our other directors here from DSAM, and also to the incredible field staff who are out in the Office of Health Crisis. I am delighted, and I have to say, in my personal private chat today, I am receiving messages from persons who are in the field who are successfully in recovery. And they are delighted not only about our launch of our campaign today for the home delivery that we're going to talk about, but also the change in availability in the campaign with the nasal naloxone. You know, I'd have to start with that. So it's great. Folks who are listening in are actually chiming in and are excited about that. We all know it's tough. And I think we've heard from our secretary and Dr. Rattay the real challenges, not only during this pandemic, but what we've experienced over the past years with my F word of fentanyl, and how we have seen the increase. I do want to give credit to the Behavioral Health Consortium and to the Addiction Action Committee and our Overdose System of Care and all the partners in DSAM, the Office of Health Crisis, and DPH. I will tell you, leading the National Lieutenant Governors Association, we are not alone in this. Our numbers are not where we want them. If we had not put in place many of the changes that we have through the leadership of DSAM and DPH, those numbers would be higher. So I just want to say that, and it matters. And to the advocates out there who are going to help us to get this naloxone, not only through our mail-in campaign to the doorsteps of our families, but to our work sites. We know, per Dr. Rattay, most overdose deaths do occur in a home setting with a family member or friend present. However, the more we have this in the hands of everyone in our community, the better. So I am honored to take a part of this today as the chair of the Behavioral Health Consortium, as a public health nurse, to say that it really matters. Truly, it's important to not only use the resources with Help is Here and the new bridge clinics, These tools and this toolkit that we're going to hear a moment from our good friends, with Next Distro, is one more that is going to be so much more convenient for some individuals. It's going to provide a level of privacy for families. But for those listening in, perhaps you're not tech savvy, perhaps you're not going to use this. Please know that all of our providers and also our wonderful pharmacies carry this over the counter. So we will have this mail-in as a wonderful new tool, but there are other incredible options. And as we approach the holidays, not to add to folks' anxiety, but those who are of Christian faith, it's 2 weeks away. And it means a lot to some persons who are at home suffering in isolation and alone. We want you to pick up that phone. It is okay not to be okay. And so again, on behalf of the Behavioral Health Consortium, I cannot thank you enough. We really look forward to the partnerships. And again, to those who go out on the street with me and the others, the peer educators, you all know who I'm talking about, and to our champions of access and treatment, whether it's Gibney, Holly, and others, we are now going to have another piece of information to leave and to share with families and employers to say, sign up, have it sent, take this quick little easy quiz. And so thank you for having me. So let's get to our guest of the hour, who can provide a little more detail on the work that she has been doing, Jamie Favero, who has wonderful experience in harm reduction, because that's what this is about, reducing harm from the overdose deaths. She has an extensive bio, which I think Jamie's probably going to forgive me that I'm not going to read the whole thing, but I'm going to share with you that as the executive director, as a founder in Washington Heights Corner Project, which is in Manhattan, she's worked a lot with persons with substance use disorder. And what I really love is that, she integrates opportunity. So when she was working with the Injection Drug Users Health Alliance, she had a coalition where she recognized with 14 syringe exchange programs how to bring health in all policy. And that's what this is about, right? So we'll be tackling many health issues. So thank you for coming and working in Delaware. Thanks again to Dr. Rattay and to our secretary who are here, and to Alexis, who's going to follow later. I just really appreciate all that you do. So Jamie, we're turning it to you. We want to hear about the wonderful program and how this is going to work.
Great. Thank you so much for that introduction. Hello, my name is Jamie Favero. I'm the founder and the executive director of Next Distro. It can be found at nextdistro.org. I've been working in needle exchange and harm reduction for almost 20 years, both in Massachusetts and in New York. And in 2016, I heard a woman named Tracy Helton Mitchell speak at a conference about her work as a Reddit recovery forum moderator. And she was hearing from people across the country who were experiencing overdoses in their households. They were in rural spaces, and the EMS, or the volunteer firefighters, couldn't get to the emergency for at least 45 minutes. And folks, for whatever reason, couldn't access naloxone in their community. So she began mailing naloxone out of her Bay Area home, and she's been doing so for many years. And as someone who had founded a harm reduction program previously, Tracy's concept really struck me. And I thought, how can we use this model of mail-based delivery to serve everyone who uses drugs and their communities and loved ones, to ensure that everyone is safe and healthy? And that led to Next Distro. So Next is a state licensed syringe access program in New York State. We were founded in 2017. And shortly after we began mail-based distribution for our harm reduction program, it's full service, we were started to get a lot of requests, not from people who inject drugs or from people who use drugs, but their loved ones. And their loved ones reached out, and for whatever reason, they couldn't get Narcan or naloxone. Perhaps the copay was too expensive in their pharmacy. Perhaps they lacked the gas money, or there wasn't a pharmacy nearby, is a major economic issue. And lots of folks were quite frankly afraid to walk into the pharmacy and ask for Narcan. They were afraid of what people would think about them, especially for people who lived in small towns. They didn't want people to know that they were accessing it or that they possibly had a concern of drug use in their home. So that led to our naloxone mailing program. And we operate in 32 states with the support of state affiliate programs like this one in Delaware. And what that means is that we operate a hub and spoke model. So we utilize our website to support people in getting an online training, taking a brief quiz and an enrollment. And then our in-state affiliate mails out their own naloxone under their own standing order using their own staff within their own state. So everything is 100% free. And as was mentioned before, we've mailed supplies to over 16,000 households across 45% of US counties. So I'm looking forward to answering any questions you have about Next in the Q&A. And it is my honor to introduce Dr. Tam. Dr. David A. Tam assumed his role of BB Healthcare President and CEO on March 17th. He's a distinguished and accomplished administrator and has experience as an officer in the United States Navy and in large public health systems. He completed his pediatrics residency at the US Naval Hospital in Oakland, California, and a pediatric neurology fellowship at the Medical College of Virginia. Thank you.
Thank you so much, Jamie. So I'm in my office alone, so I am taking off my mask, and I am very happy to be here today to represent BB Healthcare, Sussex County, and of course, all of us working in healthcare here in Delaware as we all join together to fight this opioid pandemic. You've heard from Dr. Rattay and Lieutenant Governor Bethany Hall-Long about how the pandemic has increased substance abuse amongst our neighbors, friends, co-workers, and family members. The stressors of the pandemic have created an extra burden on those who struggle with addiction. And as those who are suffering from addiction end up in BB's 2 emergency departments here in Sussex County, it adds to the strain that COVID-19 has already placed on emergency departments and health systems across the state. This is not without many efforts by healthcare systems, including us, to actually slow this epidemic. You know, at BB Healthcare, we created an opioid stewardship committee that has looked at all aspects of opioid use in the hospital. We've also focused on safe prescribing practices and protocols, in addition to other initiatives to ensure safety in the hospital and in our outpatient practices. Our behavioral health team works at engaging patients with substance abuse issues that present to the emergency room via overdoses or other identified needs. We also have a peer counselor who works and helps us assist at engaging patients who need help. And we have instituted some key questions in our electronic medical records to help identify patients who are at risk and use this tool to engage this team to engage patients and assist with treatment options. We have a very dedicated and hardworking team that is available 24/7 to provide this assistance to the community. You know, despite these many efforts and many similar programs occurring throughout the hospitals across the state, the struggle continues and every tool is necessary. And that's why we're so very glad to participate today in the announcement about these mail order Next naloxone kits that can be an additional and critical tool to fight substance abuse and save lives. At BB Healthcare, we distribute naloxone kits throughout Sussex County, and we've been doing so for a while, especially during our flu clinics and our Delaware Goes Purple events. We have seen that an increased public access to these life-saving kits, as well as an awareness, because we talk about it during these events, have made a positive impact to save lives and end the stigma of addiction. Thank you very much for all that you are doing out in the community. And we work together with you and partner to continue the fight against the substance abuse disorder and epidemic here in the state of Delaware. And it is now my pleasure to introduce Mr. Jim Deal, who is a mental health clinician and administrator who works with law enforcement, providing alternatives to arrest for those struggling with addiction. He's also a Kent County Community Resource Team member. Mr. Deal.
Thank you, Dr. Tam. I appreciate that. As Dr. Tam mentioned, I am a clinician that's assigned to work with Georgetown and Smyrna police departments to assist individuals in the community who are struggling with mental health concerns as well as addiction concerns. And I regularly, let me back up. I also serve as co-chair for the Kent County Community Response Teams, where I coordinate points of dispensing for naloxone distribution. To further point out, the community response teams, we've hosted over 28 points of dispensing, distributed 1,095 naloxone kits during the year of 2020. In the role that I have as a clinician, I regularly interact with individuals who have struggles and who have overdosed on heroin, fentanyl, as well as working with the family members who are struggling with what's just occurred. And it's boots on the ground. I look at the faces of the individuals who have overdosed. I hear the concerns of the family members who have just encountered what's taken place. And there is a real struggle that individuals are going through. And COVID has made those struggles substantially worse, especially for the homeless individuals who reside in both Kent, Sussex, and Newcastle counties. There's a huge struggle that they are encountering. So I feel like that the mail-in Narcan supply would serve to further provide services to the individuals who are struggling and make this whole process significantly easier for harm reduction and again, to save lives. I would now like to introduce Alexis Tattlebaum. She is the acting director for the Division of Substance Abuse and Mental Health. Alexis.
Thank you so much, Mr. Deal. I wanted to thank everyone for allowing me to be a part of this presentation today of information. The pandemic is taking a toll on mental health of all Americans. We know that as of late June, 40% of US adults have reported struggling with mental health or substance use. We also know that these numbers are even higher among younger adults, racial and ethnic minorities, essential workers, and unpaid adult caregivers. According to the CDC, those groups have reported disproportionately worse mental health outcomes, increased substance use, and elevated suicidal ideations. Now that we're entering the 10th month of this public health emergency and the numbers of cases continue to climb in Delaware, we are increasingly concerned for those who are most vulnerable to these behavioral health challenges. Now more than ever, we do want Delawareans to know that there is help, there is hope, and we have the resources that can help. The Division of Substance Abuse and Mental Health launched a phone line, which I know that Secretary McGarrick has already shared, but I will share it again. It is 833-9-HOPE-DE. This is dedicated to helping Delawareans cope with stress and address behavioral health needs by providing on-the-spot crisis counseling by trained counselors 24 hours a day, 7 days a week. These counselors are also able to connect individuals to additional resources in the community, including substance use treatment, mental health therapy, domestic violence advocacy, housing, and other social service supports. The website, as Dr. Rattay mentioned, through a partnership with DPH and DSAM, has also been updated with useful resources to help during this time. These updates allow for Delawareans to find up-to-date mental health and substance use provider information, which includes hours of operations, guidance about telehealth services, virtual treatment links, calendars of events, resources for food services, contact information, and crisis assistance to support short-term interventions and treatment as needed. These are unprecedented times, but there is hope, and we are here to help. No one should have to feel alone. So I appreciate everyone allowing me this opportunity to be here and to share this great news about mail order naloxone. And I look forward to seeing what we can do as a community together. I'd like now to turn it back over to, I believe, Dr. Rattay. So Dr. Rattay.
Thank you so much. Really appreciate yours and everyone's comments. Thank you to all of our co-panelists for being here today. Thank you to members of the media for taking the time to hear our announcement. This is really, really important. Really important that we get the word out there around the access to naloxone. And so we hope that you all will please help share the message of this announcement widely so that we can save Delawareans' lives. And with that, I'm going to hand it over to Jill Friedel, who's going to help us with questions and answers.
Great. Thank you, Dr. Rattay. And for reporters who are on the Zoom, you can please put your questions in the Q&A. We'll take them from there. And our first question is for Jamie. I believe Jamie said the Narcan nasal spray was free, correct? Approximately how long will delivery take?
Sure. Everything that we provide at Next Distro is 100% free. Our priority is supporting people who use drugs and their communities, families, and households. Mailing should take approximately 3 to 5 days. I think someone from the Delaware Department of Health could speak to that.
I'm going to look to Kate Brookins to see if you want to add anything, Kate.
I don't need to add anything. Jamie was correct. As soon as we receive the request from the members of the public, we will diligently process that as soon as we can and put it in the mail, and hoping that within 3 to 5 days it will arrive in the mailbox of the individual who requested it.
Thank you, Kate.
All right, Dr. Rattay, our next one. When will we be able to publicize this partnership? Many of our Sussex County patients and family members will benefit from this.
Please go ahead now and publicize this, and we can work with you to get some graphics in your materials if you would like, but we would love to work with anyone to get the word out there around the new mail order naloxone program.
And our next question is from Brittany Horn. Is all of the naloxone being distributed now from the state the nasal spray as shown in the public health campaigns?
So great question, Brittany. We have decided that for our community naloxone program that we are going to use the Narcan. So the Narcan nasal spray formulation will be used with our community program. So when you see community distribution events, you'll see the Narcan. For the most part in pharmacies, the Narcan will be distributed. With our first responders are very comfortable with using the nasal adapter formulation of the naloxone. So there are plenty of folks out there who are very comfortable with the current formulation of naloxone, so they won't be switching. But you should be seeing in most of our community events going forward the Narcan being used. And we'll say, and Lieutenant Governor may want to add to that, this is an area where we've received a lot of feedback. She's certainly seen some firsthand experiences out there in the community that especially when people are anxious at the time of use, they feel that the Narcan is an easier formulation to use. Lieutenant Governor, do you want to add to that?
No, I will. I think as Brittany knows, I know you've been out in the field with us, that particularly for persons at the time of use, they kind of can fumble. Or let's face it, as Dr. Rattay indicated, our F word, fentanyl, a lot of times people were needing more than one dose. Certainly our health providers, our first responders, they're very equipped, and they, will start with a lower dose and titration. But for those in the field, we're excited. It's easier to carry, it's easier to show. And so thank you to Public Health, not only for getting naloxone delivered at the home. I had a private question, Jill, that came up, and I don't want to mess that up, but I do want to mention it real quick. Perhaps you can answer this online for me. I don't know the answer. Is there a limit on how many doses someone can request be mailed to their home? I got that as a private question.
Jamie, I don't know if you could answer that, or Kate from Public Health.
I can somewhat explain a little bit about our enrollment process. So when you enroll, when folks enroll and they enter their name and address, they'll also answer questions such as if they've witnessed an overdose in the past year, or if they themselves have overdosed in the past year, if they have, why they're receiving the naloxone. Perhaps it's just a habit, or perhaps they're afraid that they or someone they know will overdose. We use that information to determine how much naloxone is mailed. So for someone who is not connected to people who use drugs, but perhaps just want it in case, we'll send them 2 doses. For folks who are more connected to drug use scenarios, we always try and send them more doses.
Thank you.
All right, thank you, Jamie. The next question, will the Narcan nasal spray come packaged in the standard box, or will there be accessory items such as masks and OP rescue cards?
So this is Kate. I will take this answer. The mailing that we are going to be sending out is going to be our standard naloxone package that is available in community settings as well. It will have some information included with it. It will have all the items that are available during the community naloxone events. So it's a very similar packaging. It will have that nice maroon DHSS packet included with it, and pretty much identical to what is being handed out at community events.
All right, thank you, Kate. And then Dr. Rattay, I just wanted to go back to the question that was posed, because I think other people might have it. You answered it in the chat. For people, do they have to have insurance? In other words, people who are uninsured, can they still receive the mail order naloxone?
Yeah, that's a great question. And no, there is no cost to receive this for us. And Jamie said it great, for harm reduction. We just want to get it into the hands of people who can use it and save lives. So there is no out-of-pocket cost for getting naloxone through this mail order program.
And you don't need to have any insurance to receive it?
No, you do not need to have insurance to receive it.
Okay. All right, I don't see any other questions. Any other questions from reporters? Otherwise, I think we are going to thank everybody for attending today. And thank you so much to the Division of Public Health, Lieutenant Governor, the Secretary, who unfortunately had to depart, Acting Director Teitelbaum, Mr. Deal, Dr. Tam, and Jamie. Thank you so much for your partnership with Next Distro. We really look forward to working with you. And I thank all of you today. Stay safe, stay healthy, and we'll see you next time. Take care.